Water safety is back in the spotlight this summer with a spike in the number of drownings at pools and beaches. Around 50 children drown each year in Australia, but in Asia the figure is much higher, with up to 350,000 child deaths in the water. Royal Lifesaving calls it an epidemic, and in response it's establishing the world's first international drowning research centre in Asia. Joining us now is Royal Lifesaving's Chief Operating Officer, Justin Scarr. Justin, good morning. Nice to see you.
Hi, Justin.
These figures are absolutely amazing. One child drowns every 45 seconds in Asia.
In Bangladesh, in fact, it's absolutely staggering. 17,000 children alone. It is an epidemic. It's a silent epidemic. And the reason for that is if a child drowns in rural Asia, they drown within minutes, they're buried within hours. The family mourns, but they very, very rarely make their way to a hospital, and therefore they don't get counted by international public health experts.
So it's probably worth comparing the figures in Australia and what our death rate is like compared to there.
Sure, we've been staggered. Last year we had 50 drownings of children under the age of 17, and rightly so. And this is a terrible thing,
yes.
And we should be working very, very hard on public education and awareness. But the drowning rate in Asia is up to 40 times higher than that. Population is much larger, of course, but they're also much, much harder to get to. We lack the systems, we lack the school systems, and the authorities really don't know how to respond. And that's why the International Drowning Research Centre, with the support of the Australian Government through AusAid, is absolutely critical to make a difference.
So obviously with the lack of facilities available, they're not teaching their kids to swim. They can't.
No, that's right. They don't have an awareness of how to teach their children to swim, and we've been involved with a program in Bangladesh through the Centre of Injury Prevention in Bangladesh, Swim Safe. It's a fantastic initiative where we've taken ponds, we've converted those ponds into Olympic swimming pools using bamboo and structures.
We just saw some vision there. We might have that clip again if we can just call that up.
Yeah, we've converted the village pond, if you like, into the local aquatic centre. We're training local adults, young adults predominantly, to teach their own children how to swim. It's a fantastic program, and it's also reached 45,000 children already. We haven't had a single death, and the research suggests that maybe we should have seen 40 or 50 of those children alone drown.
That's a stunning result, isn't it?
It's fantastic, yeah. and the Australian Government support, we've been working very, very hard in this area with our volunteer hours and our limited resources, but the Australian Government support through AusAid is going to allow us to further our research, but also take these important messages to other countries across the region, including Vietnam and Thailand.
So why in particular is Australia involved?
We were approached many years ago, about 4 years or so ago. Australians internationally are recognised for our swimming, our life-saving, our prowess in terms of drowning prevention. We are, in fact, world leaders. We went with an open mind. We assisted the local Bangladeshi people initially, but also the Vietnamese and the Thai people in partnership with an organisation, the Alliance for Safe Children. It's a fantastic exchange, and we're learning a lot too about how to prevent drowning in Australia.
That's great. Can I just ask you, Justin, what was the response from local families when you go to some of these villages and smaller towns and said to them, we want to teach your kids to swim? What was the response?
There's been quite a number of studies into the cultural side of drowning, particularly in a country like Bangladesh as an example. They took a fatalistic view. They thought it was inevitable their children were going to drown, and there was absolutely nothing they can do. So when we walk in with programs such as Learn to Swim, Rescue, Resuscitation, creches, which are a fantastic strategy, the villages are really opening up and embracing the strategies. It's a great example.
So far it's been 3 main nations that you've been into. How much is that costing from AusAid, and where else could it go?
Yeah, certainly the investment from AusAid is around about 800,000 over 3 years. It's a small amount of money, but symbolic. It's symbolic of Australians' commitment to Asia, helping our friends in Asia, and Royal Lifesaving will put that to great use. In 2011, in fact, we're hosting the World Conference on Drowning Prevention. Most people would have expected us to do it in Sydney or Melbourne or Canberra. We're going to do this in Vietnam, and we're doing it in Vietnam as a way of signalling to the world, to the international community, that we're serious about addressing drowning where the greatest burden is experienced, and that's across Asia at the moment.
What a great initiative. All right, Justin, thanks very much. Great to see you again.
Thank you.